Good health, a rare commodity in this day and age. Each year, 41 million people die from non-communicable diseases around the world. This is 75% of all deaths globally and have cost the lives of many young people below the age of 30 years. 15 million people have died between the ages of 30 to 69 years from this killer disease. In the Pacific, 75% of deaths are caused by non-communicable diseases. Diabetes, the leading cause of death in the Pacific region, is among the highest in the world. While the Pacific Islands pride itself with fertile land, nutritious fruits and vegetables, and the traditional knowledge and practice of planting and preparing food, lifestyle diseases increase at an alarming rate. Diabetes, if not detected and treated early, can lead to heart attack, stroke, kidney problems, and disabilities. So how do we tackle this deadly pandemic? Partnership. We can work together to turn the tide on diabetes in the Pacific through working with communities, villages, towns, and cities for a holistic approach to good health. This is what the 10,000 Toes campaign is all about. A community-based initiative aimed at establishing partnership with the members of the communities, villages, and health professionals in the fight against diabetes. It is about streamlining the health knowledge, skills, and resources and empowering the grassroots people to take control of their lives through a proactive approach in combating this deadly disease. How are we going to do this? In 3 simple steps. Equipping and training every villages in the Pacific with the use of screening kits for early detection of diabetes and other chronic lifestyle diseases. Educating and resourcing lifestyle coaches so that churches of all denominations and village halls become wellness hubs in the communities. And enhancing the capacity of health professionals in lifestyle medicine. "10,000 Toes ambassadors are the driving force of this campaign. They are the eyes and ears on the ground and the first contact for the communities. Proper training is important to ensure they are equipped to serve the community, villages, towns, and cities. With the distribution of screening kits, ambassadors undergo different levels of both theory and practical trainings. As they go from one level to the next, the more in-depth training they receive and more leadership responsibilities they assume. For the basic ambassador level, in addition to the ambassador training they should complete, ongoing practical requirements are to be fulfilled throughout the year. This includes participating in a health expo or event, recruit another ambassador, conduct at least 20 health community screenings, and demonstrate understanding on the 7 dimensions of wellness. These ambassadors are also equipped with screening kits through group trainings and are being held in villages and communities as they willingly open their doors to 10,000 Toes ambassador screenings. The screening will determine the referral pathway, and depending on their risk level, patients are referred to the wellness hubs, Hope Clinic, or hospitals. Ambassadors have been recruited across the Pacific in Solomon Islands, Vanuatu, Kiribati, Tonga, PNG, and Fiji. The campaign aims to train 10,000 ambassadors across the Pacific by 2025. To date, close to 1,000 screening kits have been distributed across the Pacific in the Solomon Islands, Vanuatu, Tonga, Kiribati, Fiji, and Papua New Guinea. The campaign will soon roll out in Tuvalu, Samoa, Niue, and Nauru. With these screening kits, more than 6,000 people have been screened in Fiji, Solomon Islands, Vanuatu, Kiribati, and PNG. The team aims to have all its data digitalized on the earlier platform and information shared to relevant health authorities. This particular afternoon, as part of their usual routine, ambassadors of Nandi English took to the street on one of the busiest suburbs in Nandi, Matintar. With the approval of this major supermarket, they set up outside and targeted its customers and staff. Members of the public from all walks of life attended the screening, some being health conscious and some out of curiosity. With it on its scale, many are seeing this machine for the first time. Intrigued with the result of one's body makeup and including one's metabolic age, it attracted a lot of interest from the public. With the advice and counseling given based on the screening results, it is no doubt these ambassadors have been well trained and experienced in community health screening. Those identified in the risk categories will be contacted and followed up with an intervention plan. Identifying and training lifestyle coaches for lifestyle intervention program is key to the sustainability of this campaign. We are grateful for the partnerships with Earlier Wellness, Adventist Health, ADRA, CHIP, and Hope Clinic. Hope Clinic in Fiji runs regular CHIP community programs and recently, for the first time, conducted a corporate version where it graduated 20 participants. Being given the green light to roll out the Live More Abundantly program in Fiji in October 2020, 60 facilitators have been trained, with 16 graduating in Nandi. Another 40 participants are currently undergoing the same training in Lautoka, and there are plans to do more trainings in the coming months. These lifestyle coaches will access to other programs on the Earlier Wellness digital platform. In Lautoka, 24 participants have been enrolled for this 10 weeks Live More Abundantly training. Today they have come together for one of their training sessions. The training is being facilitated by Mere, a registered nurse who graduated from the LMA Train the Trainer course. It was a day filled with learning, reflecting and making commitments to improving their individual health, families and communities. Trainers have been identified and trained in Fiji, Vanuatu, Solomon Islands and Tonga, PNG, whilst Kiribati training has just begun.
I'm a sick leave person for 7 years. I've been sick. I admitted in hospital. I was in ICU. So I have this sickness. I have swollen hands and legs. So I've been suffered for 7 years. And then since I've been through this LMA program, just for 3 weeks, I can say I've been cured from all those sickness that were just for 3 weeks. Until now, I'm so happy that I don't have a swollen hand and swollen leg. I changed my diet and I thank God for that.
The campaign aims at setting up churches of all denominations and community halls in villages as wellness hubs, centers of healing and hope for the communities. The vision is to have 300 wellness hubs across the Pacific to stamp out diabetes and achieving the goal of seeing a significant downturn in diabetes by the year 2030. In Fiji, training has started in preparing 12 churches to be model wellness hubs with 4 in each divisions. In Nandi, 3 churches have committed to this project and have added extensions to their current building as wellness hubs. Whilst wellness hubs at Nandi English and Votualevu churches are still under construction, the Nandi Hindi-speaking church is up and ready. These hubs will become a referral base for those patients identified during community screening in the greater Nandi area. Wailoaloa Beach is a famous tourist destination in Fiji and has one of the most affordable accommodation and beachfront bars, a frequent go-to place for locals alike. But this area is now famous for a different reason. In partnership with the Bamboo Backpackers, 3 churches in Nandi teamed up to open the B2 Wellness Bar, an open bar that sells natural herbal juices to fight against NCDs. It has become a center of influence and has gained popularity amongst the locals with herbal juices, encouraging Fijians to revisit a more natural, holistic approach to their health. At the bar, visitors can track their health through various initiatives such as the Fat Loss Program, Immune Boosting Program, a weekly medical screening, personalized nutrition plans, and a 2-hour exercise along Wailoaloa Beach every Sunday morning. The bar also provides hands-on trainings and experience for ambassadors and also affords them the opportunity to contribute to raising funds for the campaign.
It started gradually, but as we moved along, we found a passion to do this work, and we found more avenues in which to go into this health work. One of the avenues is B2 Bar, which was created as a center of influence within this community. But we found out that as we've gone through this initiative into other villages, we have come through this B2 Bar initiative and have influenced into more healthy lifestyle. And we pray that one day that this initiative will be throughout Fiji, because we've seen that they are bearing fruit as we go along. The bar has been able to finance other work within the 10,000 Toes initiative. We had 2 pilots who were grounded because of health issues, and through the B2 Bar, through the advice, through the juices drink here, they're able to regain their flying license just because of simple health advice given from the B2 bar regarding lifestyle and regarding diet. Through the B2 bar, some chiefs from these villages came and invited this health initiative to be set up in their villages. And we are excited for villages that have allowed us to be there to set up the same initiative as B2 bar. As we move forward, we will plan to other health initiatives to add up onto what we have been doing.
An important part of this campaign is the upskilling of health professionals across the Pacific in lifestyle medicine. This will enable our health professionals to adopt a holistic approach to managing diabetes and chronic lifestyle diseases. This initiative is already underway with the South Pacific Society of Lifestyle Medicine launching in September 2018 with its first conference in Fiji in March 2020, bringing together health professionals from around the Pacific. Following these, 12 health professionals passed their certifications in lifestyle medicine. The campaign hopes to encourage more doctors, nurses and community health professionals advocating for lifestyle medicine as the only effective alternative to managing diabetes and other chronic lifestyle diseases. A step up from wellness hubs are wellness clinics. These clinics will offer medical services that are not available at wellness hubs. They are manned by health professional doctors and nurses and are trained in lifestyle medicine. Hope Clinic in the heart of Suva had been a referral clinic to many at-risk patients identified through community screening by the 10,000 Toes campaign. The clinic works in partnership with the campaign to provide the needed medical service custom-made to suit the individual's condition. Hope Clinic has also been conducting both community and corporate CHIP programs and smoking cessation program addressing lifestyle diseases. There are plans to open 30 wellness clinics across the Pacific as we strive to take lead in lifestyle medicine. The 10,000 Toes campaign hopes to engage all local communities in the Pacific to be health-promoting communities, reaching out with the message of healing and hope.
So we've been doing screening throughout our community, and just a few weeks ago we've done a screening for Nakovadake to take baseline data for them. And we've gone out to the villages and we're doing it for neighbors as well. We have gathered statistics for those who are hypertensive and diabetes as well, and we are doing training. We are booking them and listing them for our LMA, Live More Abundantly program, which will be running in late this month.
Milika and Mere are two of the pioneer ambassadors of 10,000 Toes campaign in Fiji. For over 3 years, they have been going from door to door, screening people and attending to those with health conditions. It was not an easy road as they had to first convince their church to be part of this campaign. However, their commitment, passion and sacrifice was paid off when the entire church pledged their support in becoming a health-promoting church.
Dana kana ndrendre sotabi singira ora na daka Congo da baka vinaka na campaign go na 10,000 Toes and kana vasuli mai na kit ka buke kina na nonrombulo ir na leni lotu merangai da bukala mai and daka baka ni tiko bulombola and ala minamba sawi tindoni tuku rong vinaka ikirau sameri dikiro ni tal sang lotu kasa tuku ni dikiro ni kan sana extend kina valin lotu sana dota lagi na wellness hub na nataka kina vinga ravi ni tigo mbula mernanga ravi kina irna weke mami ena asa o batwali ena vestinga tambuto doko kina sando vegetarian chiko ena ngone ke ni vaccine levu ena singa tam ka kito baka binda chicken ena campaign ngo ni kena baka rute kina ya baka ngo kar sara malel baka ni kina dorbu kena ngone le ena ngono ngo er sabaka buliti kona no tori chiko ni be ya keve ngo ena ni mami lako totuba kina community work ndo baka chiko na viamba kisauti leo lilai ambaki ngo sarilele kasara solimbulo chikina na dorbu kena ngone le.
In one of their home-to-home visits, they came across a 70-year-old woman with many health complications, including diabetes and stroke.
Na mati sa tabi o tungo matin suka o tumunin ra apila sabi at kalima na baki. Me azo na ngauna rewa ngole maiki na rona ngonelewa. Ngauna ya susanga mi pamazala biau na kata uzo ko membaleta na kakana, membaleta na mati o sanga iwa muria. Sasenga na lin manu, sasenga na masima, sasenga na suka. Bunga na ngauna ronda ula kamai. Onda sorang na tumbu, pero na luto na waraw nungu suka batakin na tumunin ra. Me azo na ngauna, ko pa din ta kanon ro uti non ro reziaw. Ro tu kuna biaw ni san normal na kakere. O mandanga kinda salataka. En bagi rosa ng bulutin ka walu awas stroke kina. Satun biaw na kakere. Ya manangaw na ya me azo manangaw na ro azo maikina. Sangi wan din ta na kakana na kakere. Dira sa tingul mele bunuai. Ipa mama da tunga biaw. Ya nangaw na ro la maikina sangi wa kila wan din ta mendakan ya na kakana mele bare. Menda wakam bau takanda sakaba. Lagi ya weekend lang bula binaka. Nanda rikita kitu na bi waru takini kalu na bula na bisin. Lazo pa menisin.
Become an ambassador today. Let us join hands in the fight against diabetes and save ourselves, our families and communities, and may we see a Pacific region free from non-communicable diseases. This production is brought to you by the 10,000 Tools campaign, turning the tide on diabetes.